When we think of therapy, we instantly assume that there is a problem or an issue that needs to be assessed. However, is that really a fair assessment as to what a method of therapy is? Cognitive behavioral therapy is defined as a form of psychotherapy that treats issues and boosts one's happiness just by altering the way their mind thinks. When you see a picture of certain things, for instance, these flowers, everyone assumes that they're a different form of flowers, and everybody has their own perception of these flowers. I surveyed 25 people pertaining to this picture. Some stated that these were Easter flowers, some defined them as spring flowers, yellow wildflowers, and sunshine flowers. This goes to show you how different the mind works for everybody. Albert Ellis presented his approach to cognitive behavioral therapy in 1957. However, at the same time, Aaron Beck, too, developed his own approach. Beck's approach was known for its automatic thought process. CBT, we assume the method of therapy alters one's behavior. However, that is not the purpose or the sole reason behind this therapy. The sole purpose is to change the patient's negative thoughts and behaviors and turn them into positive outcomes. During these methods of therapy, there are several different processes that can be taken. However, every patient's therapy method is going to vary from patient to patient. Again, this comes back to the flowers, and everybody's perception of the flowers were different. During therapy sessions, the thought processes are discussed between the patient and the therapist. Outside homework is also part of the process and can be determined. Homework can consist of outside journals of the emotions, practicing the coping skills that have been discussed and suggested. Cognitive behavioral therapy sole purpose is to help the patient and the client change the negative thoughts and thinking habits and turn them into positive outcomes. CBT's center main focus is the patient and finding what is best fits them. Again, this comes back to every therapy session is going to vary from patient to patient. No two therapy sessions are going to be the same. The American Psychological Association explains that there are several different core principles associated with CBT. Some include psychological problems are based in part on faulty or unhelpful ways of thinking. People suffering from psychological problems can learn better ways of coping with them, thereby relieving their symptoms and becoming more effective in their own lives. Keys to CBT: learning what the triggers are. Every trigger for every patient is going to be vastly different. Developing the skills in coping with the situation. If you feel that you're being triggered by certain aspects, learning to deal with them on your own and learning to cope with the skills that you have learned in therapy. Avoiding the situation altogether. If you feel like the situation is escalating and putting you in a dangerous position mentally and emotionally, walking away is sometimes the best resolution. Remembering these behaviors or emotions do not have the control over you. Always remember that every situation can turn into a positive. Learning from it and adjusting your well-being is in the best interest. Developing self-awareness and self-confidence is also one of the top keys of cognitive behavioral therapy. The treatment with CBT has treated several different disorders, paranoid personality disorder being one of them. That also has treated chronic fatigue, depression, and drug and alcohol use. Cognitive behavioral therapy helps identify their depressing thoughts and evaluate how realistic the thoughts are. They then learn to change their distorted thinking habits. Cognitive behavioral therapy is all based upon changing the way you think, your mind thinks, and learning to adjust to those thoughts that you have, as well as learning from them in the process.